This conference will now be recorded.
Assalamu alaikum. Hello, everyone. Hello, Dr. Salma, Dr. Rasha, Dr. Dua, Dr. Amira, and all of you. And welcome to mrcog Success Guide family. So, today we are going to talk about our course for part 2 mrcog July exam. Firstly, we need to do the introduction and the orientation about the exam and how to study and what are the material needed. And after that, we will do some materials from the early pregnancy module, inshallah. So the first hour in the session, we will talk about the orientation. And after that, we will start our curriculum, inshallah. Firstly, I'm Dr. Shehab Ahmed. I'm an mrcog and OB-GYN consultant. I will be with you for the half of the sessions in this course. And the second half will be with Dr. Hala Shawqi. She is an mrcog and mrcpi as well, an OB-GYN consultant. So firstly, I need from you just to mute all the mics and to use chat bar. If you have any question, just send it in the chat bar. And in the middle, I will give you time to answer all the questions from your side. So after finishing the introduction, if you have any question, I will answer all the questions. And after finishing each topic in the guideline, or each guideline, so I will give you time to ask the questions and answer all the questions. So if you have any question now, just write it back in your paper or send it in the chat bar. So let's start with our journey. First of all, I need to talk about the exam pattern. For those who do not know about the exam formula, it's two papers. Each paper have 100 questions and takes around 3 hours. Each paper have 50 single best answers and 50 EMQs. The difference between the SPEs and EMQs is that the EMQ, it will reduce the chance of answer by luck. And to know the difference, EMQ mean that you will have multiple choices, around 9 to 10 choices, and 3 questions, and you will choose the answer of each question from these 10 answers. This is formulated by the RCOG to reduce the chance of luck. And it's recommended also from the RCOG in each paper to save much time for the EMQs. So it's recommended to have the single best answers in 70 minutes only or less, and the remaining 110 minutes for the EMQs. And for sure, there is a break between the two papers, around 60 minutes, but you can start earlier if you would like to start early. This is valid for the computerized based exam. And for sure, the exam paper will not be module wise. So in paper one, you may find questions from the obstetrics and questions from the gynae together, because previously there was module wise exam. In paper one, it was an obs, and paper two was gynae. But now they can be together. So first of all, you need to know what is expected, what are the RCOG expecting from you in the exam. In the exam of part 2 exam, you are dealing like an ST5. This is the training program after graduation from the college. In training program, you are passing by these years Firstly, you will be foundation training for 2 years. After that, you will start the basic training. So passing the mrcog part 1 will shift you from the ST2 to ST3. And now we are here in this part in ST5. So when you are finishing part 2 mrcog, you will be an ST6 directly. Why I'm telling you this? I'm telling you this because answering all the questions in part 2 exam, it depends on that you are an ST5 only. So you should know your limitation in the exam and do not take decision that it's needed to be done by the consultant. So now let's talk about the material. For the exam, we have the green top guidelines, the nice guidelines, and the talk articles, and some guidelines from the Faculty of Sexual Health and Reproductive Health, and PASH guideline, and some scientific impact paper and praise, and the consent advice. Please, for all of you, do not depend on any box in study. Do not use any book like algorithms or something like this because RCOG depends on updating guidelines. So every year there is around 10 to 12 guidelines in each topic, in different topics, I mean. So most of the books are old. You will find that they are released in 2017, 2018, 2020, but not more than that. And believe me, around 70% from the questions in the exam, it will be from the recent guidelines in the last 3 years. So it's not recommended to use any of these books, and it's recommended to start practice from the guideline itself. And I will tell you in the next slides how we can practice from the guideline. Firstly, we have the green top guidelines. Around 50% from the questions in the exam will be from the green top guideline. So how we can practice the green top guideline? First of all, you should make sure that you have the recent copy of the guideline. And I will tell you one example for this today, because to know the importance of having the recent copy of the guideline, because there's many changes happen every year in many topics. And after, how you can know that you have the recent copy of the guideline? You will know this by opening the RCOG platform and search by the name or the number of the guideline. You will find that in the portal that you have the recent one and when it was released. After that, when you start reading the guideline, you should read all the information, including the recommendations and the details in between the recommendation. And after reading all these recommendations and reading all the details and the numbers and percentages and all these points, now you will make your own notes. You will make your own notes by highlighting the recommendations and highlighting the important points and percentages in between the recommendations. After that, you will put a stepwise plan for following the guidelines, and you will do your own algorithm. And if you have any algorithm or chart in the guideline, believe me, exam will be in this chart, especially in the EMQs. So firstly, you will make sure that you have the recent guideline, then you will read all the informations and then make your own notes and do stepwise plan. Stepwise plan, it's meaning that the first choice in the management is this one. And if it's not valid for me, so the second is this, the third is this. So I know the stepwise management in each topic and each disease. The last thing in the Green Top guideline, if you study the guideline and you find after that that there is a new one released, so now you need to read the newer guideline. So you will read the new one and you will mark about the information that it changed and updated, and you will add them and compare them with the old recommendation. And do not remove all the information in the old guideline, because sometimes there is an informations in the old guideline needed also in the exam. So you will just read the recent one and you will add the updated and different information from the previous guideline. And we have today an example for this point, inshallah. Second thing, which is the NICE guideline, the National Institute for Health and Care Excellence. These guidelines are important. You should read every word in the guideline of NICE guideline, especially in the certain points, in certain topics like the labor module and the infertility and preterm labor and some different modules. We will talk about them and we'll send the material for you. You should read all points in the NICE guideline. Do not read the researches, the percentages, and the audit in the middle of the guideline. Just read the solid information about each topic. After that, the most important and missing point from your side before the exam, and it was critical, especially in the last 3 years in the exam, which is the talk article. The talk articles, they are an articles that it's released yearly by a magazine in UK, which is called the Obstetric and the Gynecologist articles. Each year there is around 15 to 12 to 20 new topic. These talk articles are done for the information that is missing in the Green Top guideline and NAS guideline, or that if there is a recent update and it's not there in Green Top and NAS guideline. This talk article is important because updating Green Top guideline and NAS guideline, it took much time. So you will not find that there is the Green Top guideline updated after 1 hour from the last one. It took around 4 to 5 years to update the old one of the Green Top guideline. In the middle, you may find a talk article talking about these updates and the recent research is done. So for your exam, it's very important to do all the talk articles in the last 3 years, because there's around 40% of the exam mark, it will be from the talk articles. And do not depend only on the last 3 years of talk articles, but you should also do the talk articles that was older than 3 years, if they will help you in the exam if you don't have the same information from the Green Top guideline or NICE guideline, or if they are not covering this topic, like phenylketonuria, like many topics are talking about something different than the Green Top guideline and NICE guideline, like supraventricular tachycardia. It's not also discussed in the guideline of Green Top and NICE. So we will go module wise and we will talk the related older talk articles and the newer talk articles in the last 3 years. Okay, so how we can do the talk article? First of all, we need to read all the talk article, and then we will mark all or the information that's newer for you or you don't know about them. And again, you will do a stepwise management if there is a stepwise management. And if there is a chart, it's a must to memorize everything in the chart. of the talk article. Then the last part, which is to answering the CPD questions related to each talk article. And if there is talk article related to or complementary to a green top or nice guideline article, so you need to compare between both of them and to add the extra points from the talk article, because some questions in the RCOG exam, it will be from both guidelines together. And you will not answer the question without knowing the recent talk article talking about the question and comparing it with the recent green top or nice guideline. After that, there is less important points and less important articles, like the articles of the Faculty of Sexual, Reproductive and Health. And these articles, it's specifically for the contraception. We will discuss about this in the sexual health module. The PASH guideline also, it's specifically done for the infection module. Some points also of the scientific impact paper. Scientific impact paper, it's not that too much important. Just many topics we will discuss from the scientific impact paper, which is not covered by the Green Top guideline or NICE or TOG article. And if you find the topic that you read in the scientific impact paper there also, or it's done by the TOG article or Green Top or NICE, so it's unnecessary to read the scientific impact paper. Then we will talk about the clinical governance topic and the consent advice. Consent advice, it's done for the operative or surgical module. And all these topics will come in the exam for less than 10% of the exam mark. So it's not that too much important, and it's not a wise decision to spend much time in these topics and not cover all the topics of the Green Top and NICE and TOG article. Please concentrate well for this point. There is some terms that it's important for RCOG part exam to know. The first thing, which is the cut. Whenever you are covering any Green Top guideline or NICE guideline or TOG article, you should know the cutoff. What the mean of cutoff? The cutoff, which is a number. Below this number, you will do this decision. Above this number, the decision will be different. I mean, let's take an example. For the patient that having a previous preterm labor and you are going to screen the cervix by transvaginal scan. So this patient, you will do a transvaginal scan to check the cervical length. If cervical length is less than 2.5 cm, so you will decide about doing cervical circulation. But if more, you can continue screening every 2 weeks, and it's not recommended to do circulation, right? So the difference, so there is a change in the decision as per the cutoff. The cutoff here is 2.5. So it's very critical in the exam to know every cutoff in each topic. And you should put a red mark on each cutoff in any topic that you read, because they love the cutoff. The second thing, which is the difference between the terms of offer and consider. While you are reading the guideline, you will find that some points there told you that we offer, you should offer this or you should consider this. The difference is that offer mean that you should do this recommendation. If I told you that you should offer the patient cesarean section, so this means that no other option, you should do cesarean section. If I told you you should consider the patient to do cesarean section, this means that you can do or you cannot do, after counseling the patient about the options and the risks and all these things. So this means that offer you will not revise anything. You will go directly for the recommendation. But consider you will revise all the situations and you will read the question very sorry you will read the question and concentrate on every single word, because there is sometimes there is a point or a number or a mark that will change your decision and you will make you only to consider not to offer. And there is some situations in the exam you will you will find that recommendations say you can offer this option or you can consider another option. If you find that you have two valid answers, one of them are offer and one of them are consider, please go for the option of offer, because as I wrote here, offer always having the upper. It's more than it's powerful than consider. Okay, and also we will have one of these examples in the early pregnancy module, but not this session, the next session, to know more about this. Okay, so now we are practicing all the green top guideline and nice guideline, and we need to practice books. What are the important books to practice while we are doing and studying the guideline? Firstly, it's very important to cover all the recalls in the last 5 years, because around 40 to 50% of the exam, you will have a mark, you will have a questions from the recalls. And why it's important also to know this, because the answer of the question that you will came in the exam from the recalls, all of the candidates will answer. So you will be the only one that answer wrong this question. So this will deduct your mark and decrease your chance of success, of passing the exam. So it's important to cover all the recalls in the last 5 years. After that, the important book for single best answers and EMQs. And these are the examples of the most important books to cover: Andrew Caesar, Amanda Jones, Gupta, Mastering, Andrew Caesar, the old one of single best answer, succeeding book, Konji, which is a little bit difficult than the previous one, and Tahir Mahmoud book, and P. Sinha, and Andrew Pickelington. I will send for all of you the source of this books, the soft books in the group to practice. And I will tell you how to practice now. How to practice the books for the single best answer and EMQs. Firstly, after covering and finishing all the modules of, after finishing all the topics in one module, you should practice a module-wise books. There is some books of single best answers and EMQs are divided by modules. You will open these modules and you will practice all the questions about the modules that you finish. And after finishing all the modules, firstly, you will practice the recalls, because recalls are not divided by modules, and then the non-module wise books. And after the second revision, you should revise all the mistakes in the recalls and book that you mark about them when you practice for the first time. And after that, in the last 2 to 3 weeks before the exam, you should do the recalls of the last 5 years for around 2 to 3 times before the exam. This is one advice just to increase the chance of passing in the exam. You should have good time management. All of us, we have works, we have operations and clinics, so you should have time management for studying and practicing the books and the questions as well. And you should have a short-term plan and long-term plan. Short-term plan for it's like a plan for 1 week, and long-term plan it's a plan for 3 to 4 months. And the last thing, you should have a partner, a study partner for your exam. It's very important to have a study partner for studying and practicing the questions together. This will help you in saving time and will help you also in brainstorming for the question and answer. This is our course. For our course, we have the free group and the premium group. In free group, you are allowed to have all the live sessions and to be an active member, like sending questions and answering all. I will answer all the questions from my side, and also Dr. Hala will answer all the questions. The premium group will have access to all materials, all books, and practicing all the questions, and also will have access for the records of the sessions from the mrcog Success Guide family. I hope all of you have